Hi, my name is Veronica Carlisle, and I'm the Community Health Educator at UNC Lineberger Comprehensive Cancer Center in the Office of Community Outreach and Engagement. Our office developed a community pilot funding program to partner with communities as they work to address their cancer-related concerns. We took just about a year researching community funding models and worked closely with our Community Advisory Board to come up with the program that we have today. In this first cycle of our funding, we have awarded 5 organizations $10,000 to conduct their work over a year. The purpose of the Community Pilot Funding Program is to support North Carolina communities in identifying as well as documenting their most pressing cancer-related needs. It's also to foster the skills and abilities of the communities to ensure that their efforts to address their local cancer issues are sustainable. And finally, to facilitate a sustainable collaboration relationship between North Carolina communities and Linebergers. As I like to say, we're not a one and done office. Any organization or community group across the state of North Carolina was eligible to apply as long as they demonstrated they were committed to serving communities facing cancer health disparities and aimed to address these disparities. This particular mechanism was not for academic entities or individuals. We really wanted to make sure that the funding was used solely to support the efforts of communities. There were 2 options to frame the proposals. Organizations could conduct a community cancer needs assessment that would collect and assess baseline data on the selected cancer issue. They could also establish or expand the focus of an existing coalition to determine how best to address a local cancer issue. Or they could do both of these. In fact, several of our awardees did both. Speaking of our awardees, now you'll hear from a few of them as they share information about their experience with the Community Pilot Funding Program. First, let's meet Dakiah Rowe with the Martin Tyrrell Washington District Health. She will provide an overview of her organization's experience in the funding program.
Our previous health education supervisor actually applied for funding through the Community Pilot Funding Program to help our organization better analyze the burden of breast cancer, lung cancer, and tracheal cancers within the African American communities within Martin County. So during some of our transitions with staffing, Veronica has been so helpful and so supportive in helping us to navigate that and also answering any of the questions that we may have. And I think that's one of the greatest things about this type of engagement. We wanted to engage in a funding program that would help give us some additional financial support during our analysis of cancer, but to also provide us with the technical assistance that we may need and also networking opportunities. So because we engaged with the Community Pilot Funding Program through UNC, we have access to their vast network of resources. And not only that, but they in turn have access to us as Martin County and get to learn a little bit more about what it is that we have to offer. So it's really a win-win situation because we get to grow and learn from each other. And it not only benefits our health department and UNC, but also the communities that we serve. In the future, we would definitely like to partner for more opportunities with the funding program because of the amount of support that we have received so far just with working with them for this grant opportunity. And even through the application process, you all have been so supportive in helping us by providing feedback that will be helpful for us in future plans and in writing grants. So we are so grateful for the opportunity for the Community Pilot Funding Program that it has provided us, and we look forward to the way that it will benefit our communities and the continued partnerships that will follow because of it.
Next, we will have Margarita Gonzales, who will talk about work her organization is doing in Western North Carolina.
So I'm with Western Carolina Medical Society, and I'm project manager for this Lineberger funded community engagement effort. We're looking at access to colorectal cancer screening in McDowell County, North Carolina. McDowell County has very little access to screenings, but it has the 10th highest rate of incidence of colon cancer in the state. So we're engaging with community members. That means providers, community health organizations, and with patients to learn about more about the barriers to care and what we can do about that. We're performing community-based participatory research, or CBPR, and we will come up with an action plan for how to broaden access to colorectal cancer screenings. But how we do that is going to be up to the community. We have created a survey that will be administered to patients, and we have professionals who are stakeholders who are going to help us come up with the action plan. We took special care to engage organizations that work with uninsured people, as well as with Black and Hispanic residents of McDowell County, because all of these groups have higher risk of developing colon cancer and lower rates of screening than white residents do. Lineberger has been an incredible partner so far, very flexible. We had to reevaluate several steps of our original program plan because of the ongoing COVID-19 pandemic, and Lineberger made that very easy. We also made modifications to the method of doing our research after talking with some community organizations and learning about the climate in McDowell County as far as broadband access, use of technology, and historical representation at community gatherings. So we're very grateful that Lineberger has listened to our requests on how to better conduct our research and outreach, and they've let us make changes. This funding has allowed us to lay the groundwork for future work. We can't always just look up statistics for our area like this to put into a grant proposal. So we're doing our research in the community, pairing it with available research, and we hope that it will lead to future work with Lineberger as well as with other funders.
Lyn Jenkins will provide us with information about her community and how they're using their funds.
Lyn Jenkins, Executive Director of the Community Care Clinic of Dare in the Outer Banks of North Carolina. And our project through UNC Lineberger's Community Pilot Funding Program is titled Assessing Disparities in Health Equity of Marginalized Populations Related to Oropharyngeal Cancers. We are the only primary care organization dedicated to serving uninsured or underinsured financially challenged adults in the Outer Banks. Because of this, we are able to utilize UNC Lineberger's funding to identify cancer health disparities and engage this target population. We chose to focus on oropharyngeal cancers for a number of reasons. First, our most recent community health needs assessment identified a higher incidence rate of oropharyngeal cancers as compared to the state or the nation. We know that risk factors associated with oral cancers plague marginalized populations that we serve, such as increased tobacco use, alcohol use, and those are responsible for 75% of oral cancers. And it's known that, sadly, uninsured Americans smoke at a rate more than double that of their insured counterparts. Our marginalized populations are burdened with food insecurity. They have nutritionally poor diets. They are vulnerable for their lack of access to dental care, which actually is a complete lack of access in our dental desert area for uninsured low-income adults. Through this funding, there are wonderful bilateral benefits for both UNC Lineberger Cancer Center and the Community Care Clinic of Dare. We are using the funding to support a survey platform to regularly assess our 700 plus patients, as well as funding to get out into the community with mobile clinics, mobile health screenings, and actually assess the community. And we're going into the pockets where we know there are a lot of uninsured, financially challenged adults living or working. We're able to connect with community health workers in our area to learn what the dental needs are, and also to help educate people, find about risk factors, signs and symptoms. For UNC Lineberger Cancer Center benefits, are that we are helping them build sustainable collaborations. For example, we are a member of the North Carolina Association of Free and Charitable Clinics. And through that organization, we can connect UNC to over 75 free and charitable clinics across the state. And those directors can then have their staff reach out, and that way we all will extend UNC Lineburger's reach into each community, especially with marginalized populations. So through this wonderful pilot funding program, we're helping UNC Lineburger actively engage our community, help identify disparities, and work to address oropharyngeal cancers and reduce the health inequities. We will be able to build on the information we're gathering now to seek further funding to address these cancers and actually implement solutions.
Finally, we'll hear from Dr. Shelton in Eastern North Carolina and the work his hospital is doing in lung cancer.
Hi, I'm Dr. Shelton, Charles Shelton. I am a chair of cancer services at the Outer Banks Hospital, which is a small critical access hospital in Nags Head, North Carolina. I'm happy today to talk to you about a community funding pilot project with UNC in collaboration with various institutions within our state. And I'm happy to be one of those partners that has benefited from this community funding pilot. Just wanted to talk briefly about how helpful that is and what a great way it is to collaborate with academia. So, one question would be, why would we engage through a funding program? My belief is that any research that looks at identifying problem areas in our healthcare, and what I do in particular, which is cancer, and offers areas of improvement potentially by engaging with academic centers of excellence, is a win-win model. And so that's part of the reason that we chose to collaborate with UNC through the Department of Community Outreach and Engagement. So you might ask, what are the benefits then from engagement? I believe that the expertise of academia, the resources that are available, for example, at UNC, are things that we could never muster in a small community. We have folks that can analyze our research data that we gather as part of a collaborative effort. And this data can then be looked at as sort of a larger bird's eye perspective that can help perhaps change policies on a larger scale as well as within our smaller communities. So certain things that I think make this model of collaboration work. One is we have to have a mutual interest in discovering reasons for example, disparity. Disparity in my case is healthcare disparity. I'm interested in why do certain areas in parts of North Carolina not do as well with, for example, cancer deaths, mortality from cancer. Why are certain things different? Why do screening rates differ in certain parts of the state? So by studying these through collaborative models with institutions like UNC, we're able to find something that is not just applicable to a small community such as ourselves, but something that perhaps may be more broadly universally useful. And the example that we are lucky to participate with in this particular model is looking at lung cancer. Lung cancer is the largest cause of cancer deaths in our nation. It's the largest cause of cancer deaths in our state. It is by no coincidence that it's the #1 cause of cancer deaths in our hospital region as well. So this was a project that I believe through collaboration would help not just us locally, but may potentially benefit other counties, other states, and of course other hospitals. So, some folks say, is it worth the effort, or would you consider future collaboration? Absolutely. I would say consider this if you're an institution that does not have resources and you want to have access to resources from a much larger institution who is willing to help you. This is a win-win collaborative model. We're fortunate to be the only critical access hospital in North Carolina that is cancer accredited, and the only way we were able to achieve cancer accreditation is through collaboration. We by no means have all of the resources available to treat every type of cancer in a small community of only 30,000, but by collaborating with folks like UNC, with other academic partners within Eastern North Carolina, we were able to achieve cancer accreditation, which is a huge, huge benefit. And so this model absolutely works, and I wholeheartedly support it. So lessons learned, I think collaboration helps all communities, and I think funding helps develop the ideas, even if it's on a small scale. These help benefit ideas that can become innovative in a small community that can then be further amplified to a larger scale. So thank you very much for your time, and I appreciate allowing us to be part of this initiative in North Carolina with UNC as a partner.
After listening to our awardees, you may pick up on some themes. Awardees talked about reaching some of their hardly reached communities. They shared how they are able to collect data from communities where there is no existing data on their topic. And almost all of them mentioned partnering or other stakeholders as they're doing their work. And this is just to mention a few. I'm sure you saw some others or heard some others. So what makes this work? Of course, there's the funding support, but it's much more than that. We also provide technical assistance, starting with the preparation of application prior to submission. We also provide technical assistance during the period that awardees are conducting their work. There are the resources of Lineberger, of course, including the expertise of its researchers. It's important to have good communication and reporting, as well as it's important to be flexible as situations change. Looking at the end of the funding cycle, we anticipate other areas where we can assist our awardees. We can provide letters of support for those seeking other funding. We can provide training on the implementation of evidence-based interventions should one of the organizations decide on an evidence-based intervention as a solution to its cancer concern. Our office is excited about the work of our awardees. It is work that benefits their organizations, Lineberger, and ultimately the community. We're partnering to reduce cancer disparities and improve cancer outcomes in communities across the state through a community pilot funding program.